Professor Slavin, you're one of the leaders in treatments of cancer in Israel, and you've done all sorts of experimental treatments. Please tell me about the different types of treatments that you offer today.
Well, unfortunately, available anti-cancer modalities fail to cure the patients in a large number of situations, and this is why cancer continues to be the leading cause of death worldwide, despite progress in medicine. And therefore, there is an urgent need to try to develop new approaches to improve the cure rate of cancer. And that is why I'm obsessed to investigate new approaches to cure cancer. And of course, I do everything in conjunction with experimental medicine, testing every new procedure on preclinical animal experiments, both in hematological malignancies, leukemias, lymphoma, myeloma, etc., and metastatic solid tumors. And when I find a method that makes a lot of scientific sense and successful results in preclinical animal studies, I'm obsessed to try it for treatment of patients, especially when patients have no response to conventional treatment and have no chance to be cured by any of the available modalities. This is the only way to make progress in treatment of cancer. It makes no sense to repeat treatment that is known to be ineffective.
But some of these treatments which were performed here in Israel were somewhat controversial. Why is that?
Every new cancer treatment, every new treatment in general is controversial. Anything new in any field is controversial, whether it's art, whether it's dance, whether it's painting. Anything new is frequently controversial. Only when it is shown to be effective, then of course everybody claims that he invented it, that it was his original idea, and then it becomes conventional. Unfortunately, if it ain't broken, don't fix it. This is a well-known rule. But if a patient comes to me and is incurable, every expert says there's no way to cure the patient, and I think that it can be done using a new procedure, innovative procedure, I'm obsessed to try it. That's all. Luckily, I was successful in the past, and many things that were shown to be successful in one patient became treatment of choice worldwide.
So let's talk about success rates. What is success to you in these types of treatments? And do you have success stories?
Of course, we have many success stories for the past more than 30 years. Success, when you talk about cancer, I mean cure of cancer. I mean disease-free survival with no additional medicine. This is cure. The goal is to cure the patient. If curing the patient is impossible, then maintaining quality of life and prolonging survival is the next best goal. But nothing less than that.
With cancer, it's known that you need to be in remission for at least 5 years for it to be considered really a success, that you're cancer-free. Do you have any patients that have reached that long?
Of course, we have the first patient that was considered incurable and sent home to die is now 32 years out with no evidence of disease since he got the first treatment. That first treatment is now known as donor lymphocyte infusion, and that resulted in cure of thousands of patients. In other words, thousands of patients worldwide owe their life to this new patient that was cured after being considered by all the local experts as incurable. Actually, he was sent home to die. I'm not talking about one patient. I just told you about the first patient that indicated that cell therapy using donor lymphocytes can cure cancer when everything else fails. However, following that patient, we introduced the same principle for many patients following successful allogeneic stem cell transplantation for leukemia, and subsequently we improved the method and used cell therapy without stem cell transplantation, just cell therapy alone, because the rationale was if cells can cure patients that major doses of chemotherapy and radiation failed, why do we need the transplant procedure at all? Why not treat the patient at the stage of minimal disease by cell therapy alone, which is a simple outpatient treatment, half an hour treatment that can cure the patient if applied at the stage of a minimal residual disease. So since that time, our strategy has been, if you want to cure cancer, it is very important to do it initially, upfront. Namely, use conventional medicine to induce remission, a stage of invisible cancer, which can be accomplished in more than 90% of the patients, both hematological malignancies and metastatic solid tumors, and at the stage of minimal residual disease, not send the patient away thinking he may be cured. You know very well the high-risk cases, and you know that even if after successful treatment there's no more visible disease, it does not mean that there's no more residual disease. Don't forget that 1 million cancer cells are the size of a head of a pin, 1 millimeter, which is invisible by any imaging technology. And therefore, if the oncologist thinks that he doesn't see tumor any longer, it means nothing, because the patient may have millions of cells all over the body. They are invisible. Don't forget that not only 1 million cells are invisible, every cancer begins with one single cell. And therefore, the oncologist, the hematologist, must use his prior experience. He knows which cancer cells can be cured and which cannot. And those that are likely to be cured, why not try to cure them by elimination of minimal residual disease at the first stage of the disease, avoiding months and years of suffering from chemotherapy, unnecessary cost, poor quality of life for the patient and for the family? Why not cure the patient up front, before cancer cells become resistant to chemotherapy, when the chance of cure by immunotherapy is so good, as we have proved with hundreds of patients, both with hematological malignancies and solid tumors?
Well, I must say you sound very convincing, but if this is the case, then why isn't everyone else doing this? Why aren't other doctors in Israel performing these treatments?
This is the $60,000 question. I'm asking myself, how comes doctors don't accept facts? And this is it's a common problem in the world. When people started to say that the world is round, nobody believed them. When they said that, that Galileo said things, he was crucified, just because he said something which was unacceptable. Doing things first is difficult. Not everybody can withstand the skeptical approach of the experts. But we have shown this to be effective in many, many cases. And immunotherapy that was considered as something which is really false hope is now becoming the leading major progress in medicine. If you look in all the recent meetings of the ASCO, American Society of Cancer Oncologists, or all the international societies, always tell you nowadays that immunotherapy is the hope for cure of cancer, something which 30 years ago nobody believed.
So that this is research. Are there other places in the world, other doctors such as yourself, who perform such treatments?
Nowadays, what we started more than 30 years ago is now acceptable worldwide. I don't know any clinic in the world that doesn't use cell therapy for treatment of cancer. So something that was initially considered experimental and undocumented, unproven, now is being used routinely. After stem cell transplantation, cell therapy can cure the patient that failed the transplant procedure. And nowadays, cell therapy is used for treatment of different kinds of cancer. And the latest, la dernière cri, as they say in French, l'tza'aka achorona in Hebrew, is the CAR T cells, which is again cell therapy against cancer. So cell therapy is now becoming a leading procedure for making progress treating cancer. And by the way, we are now involved with a new procedure that I just now patented that involves a new approach that will both kill existing cancer cells and result in development of long-term anti-cancer immunity. So a one-step procedure that will kill the cancer on the one hand and will induce immunity or vaccination against cancer later on, such as if some cancer cells escape, or if cancer re-emerges, the patient will have resistance. And I hope this new approach will be a game changer in cancer, but it remains to be proven. We are now involved in experiments to try to prove the hypothesis. But my feeling is this is the future.
Well, that almost sounds too perfect to be true.
That's true. I agree. It is too good to be true. But that is my hope, my belief, based on scientific data and some preliminary experience. Whether or not I'm right remains to be seen.
So where else in the world are they treating patients the way you do?
Well, cell therapy, as I said, is now accepted worldwide. The conventional stem cell transplantation, in other words, the way to try to cure cancer by lethal doses of chemotherapy and radiation, followed by rescue with stem cells, we changed it, and it is now changed into mini transplant. The big transplant was now changed to become a mini transplant, which can be done on an outpatient basis. In other words, replacing the concept of trying to kill cancer by more aggressive, more lethal procedures with smart procedures. It's much better to be smart than to be strong. By smart procedures, we're using the immune system to do something which chemotherapy and radiation fail to accomplish.
So what is the problem here in Israel?
Well, the problem is not in Israel, the problem is worldwide. Regulation is very tough, and in order to get approval of a procedure, you need to prove that it works. And regulatory authorities require prospective randomized clinical trials in order to prove that something works. This is the conventional way. In other words, a group of patients receives control, another group of patients will be treated, and you have to show the treatment is better than the control. That is possible when you're talking about drugs, because every patient will get the same drug. So you can compare between the groups. That is the only way to be sure that the drug really works. However, with cell therapy, it is impossible to do because every patient gets different cells. Not only that every cancer is different, there's no two cancers that are the same. There are no two patients that are the same. And in addition to that, every patient gets a different treatment. So how can you do prospective randomized clinical trials? It's impossible. You have to develop a new strategy which the world has not yet encountered. Moreover, to do a prospective clinical study and get approval of a drug, it costs between $1 and $3 billion. $1 to $3 billion. Which company will put so much money for treatment that cannot be sold, in boxes or in packages? Because every patient gets a different treatment. So it's very difficult to use the standard procedure for approval of any treatment when you're talking about cell therapy. And therefore, we have to develop, not we, the regulatory authorities must think about ways how to solve this problem. And until that problem will be solved, the authorities, the Ministry of Health, they say, well, this is not a documented procedure. It's not approved. It did not go through prospective randomized clinical trial. But as I said a minute ago, it is not possible to do prospective randomized clinical trial. Big pharmaceutical agencies will put a lot of money to prove that the drug is effective. Why? Because if they are right, they will sell the drugs for much more money. However, they cannot do the same thing with cell therapy. So why should they put so much money?
So what is the problem of the Ministry of Health here in Israel? Isn't it in their best of interest to want patients to heal, to want patients to get the best care possible?
Yeah, in principle, you're right. Unfortunately, they don't think like that, Unfortunately, they want to mimic other regulatory authorities that are afraid of cell therapy because of reasons that I told you before. And instead of thinking smart and being a leading in this field, because we started first, more than 30 years ago, instead of taking advantage of our expertise, of our good experience, they decide to hide behind the lack of prospective randomized clinical trials to prove that a drug is effective, something which cannot be done to start with, as I told you before.
But they say that you experimented on patients without going through the Israeli protocol, the legal protocol that you're supposed to. What do you have to say to that?
The answer to that question is very simple. As a doctor, I can do everything that is legal, in other words, any treatment that is not against the law. Okay, I cannot use, for example, a drug that is not approved because there's a clear-cut law that says that you cannot do it. You can only use drugs that are approved. But there was no law against cell therapy. And this is why when the Ministry of Health tried to stop me, I went to the court. I took them to the Supreme Court. And the Supreme Court ruled in 3 different occasions against them and told me, go ahead and treat the patient, against the Ministry of Health on 3 occasions, okay? Because there was no law against it. And when it came to the Supreme Court with 3 Supreme Court sitting, including the presidents of the Supreme Court, the president of the Supreme Court told the Ministry of Health that they have no right to stop me because I didn't do anything wrong. I didn't do anything against the law. And they told them one more thing. If you want to stop Slavin, you have to change the law. And they did. They changed the law. If there was a law against it, why would they need to change the law? They changed the law because that's what the Ministry of Health told them. And since then, I cannot do it, unfortunately. I think this was not a smart decision. It was a counterproductive decision that instead of keeping Israel up front in this field, they stopped it with arguments that are, I don't want to call it by name, but it was not a smart decision.
The general manager of the Ministry of Health was quoted saying that medicine is not like art. You cannot do what you want. You cannot be creative as you wish. What do you have to say to that?
Well, first of all, I never treated any patient with anything if conventional medicine could help. I always do it when nothing else exists, and luckily I was successful. I mean, you can't argue against success, okay? So the Ministry of Health were told that they have no legal right to stop me because I did not do anything against the law. And as a result, of course, it was an exceptional situation when Shimon Slavin against the State of Israel won the case, and as a result, they wanted to intimidate me and said that I did not behave like a doctor.
But they did close your clinic for a year.
No, they did not close the clinic. They closed the clinic for 2 weeks until I met with a doctor in charge of Tel Aviv, and she sent me a written letter that after they visited and listened to everything, the clinic is open from that day. This is written and signed by the doctor in charge of the whole Tel Aviv area. I repeat, after they visited me and listened to all the facts and the argument, they issued the letter that the clinic is open starting today. It was never closed for 1 year, never.
So according to the new law,
Yeah.
what is not allowed and what is allowed to be performed?
According to the new law, cell therapy is like a drug. In other words, you need to get approval to use it. I told you why it is not possible to do with conventional methods, and therefore we are stuck. Cell therapy is out, except for experimental treatment that must be approved. But there are many problems. First of all, treatment that must be approved by the regulatory authorities must be done in the hospital, okay? And right now I'm not in the hospital. I'm in an outpatient clinic. Secondly, if you do experimental treatment, somebody must pay for the treatment. You cannot charge the patient for experimental treatment. So the question is, who will pay? If the patient cannot pay, somebody else should pay. Normally, who pays for experimental treatment? The pharmaceutical companies, because they have an interest. If you show that something works, they will make more money. But as I told you, they cannot make money from cell therapy because every patient gets a different treatment. So who will finance the research? Meanwhile, patients die, and patients don't want to wait. Even if there would be any major donor that will give all the money, it will take you 5 to 10 years to prove the point. But if you have a child that is going to die within a year or within 6 months, you cannot wait 10 years. Okay? So we have a serious problem here, logistic, ethical, economical. It's a very complex issue. So either you say, well, if there's no treatment, you tell the patient, I cannot treat you, bye-bye. That's easy. Then nobody can blame you. But the patient dies, and there's no progress in medicine. And I told you initially, I'm obsessed to find a cure, even when conventional medicine is not expected to be curative. And I do it while avoiding doing anything that is illegal. As long as it is legal, I can do it. If it is illegal, I cannot do it. So when it was legal, I did it. And the fact is that the Supreme Court supported me. And when it is illegal, I stopped doing it. It's very simple.
What is the status right now? What kind of treatments are you not allowed to perform, and what kind of treatments do you perform?
Okay. I cannot allow to treat patients with cells that were treated outside patient's body. It's called ATMP. When there is a procedure that involves major modification or management of cells outside the patient's body, you cannot do it by law. So I don't do it. And therefore, you can only do procedures where the cell that you use has been obtained and infused to the patient the same day. For example, if you take cells from the fat tissue, like plastic surgeons do, and do filling of wrinkles in women or impregnation of breasts, okay? And you do it in one day. You take cells and you treat that day without manipulation. That is allowed. But if you want to expand the number of cells, to use more cells, not just what you take, which is not enough, you need many more, then it's not allowed. So that is the whole difference. And unfortunately, due to the counterproductive and destructive approach of the Ministry of Health, we cannot treat patients with killer cells, cells that are activated to become cancer killers outside the patient's body.
What about stem cells taken from a fetus or from the umbilical cord of a newborn baby?
Well, cells taken from a fetus are not allowed, not only by regulatory authorities, also by scientific arguments, because they are dangerous. Any fetal or embryonic, especially embryonic cells, are dangerous. They can cause cancer. So nobody uses them. They are out. The only cells that are safe are cells that can be obtained after the baby is born. Let's say from the cord tissue or from the placenta or from the cord blood. Mm-hmm. These cells, you can treat the patient if you do it on the same day. You cannot culture the cells. You cannot enrich the number of cells that you want to use because that's not allowed.
But those cells taken from the placenta and from the umbilical cord, once a baby is born, are now being kept for many years and offered to couples having a baby for their own benefits and health later on.
Correct. The question is, which cells are you talking about? There are some stem cells, hematopoietic stem cells, cells that are used to produce red blood cells, white blood cells, platelets, immune system cells. This is the cord blood. The cord blood is unmanipulated. You just freeze it. And when there is a need, you use it. That is okay, no problem. But if you want to use cells for regenerative medicine, you need to use multipotent stem cells called mesenchymal stromal cells. Mesenchymal stromal cell concentration in any one of the tissues is too low. And in order to use them successfully, you must enrich, you must increase their number. And increasing the numbers means culturing in a cell processing center outside patient's body. So it cannot be done the same day. And that's not allowed. So you cannot use a sufficient number of cells for any treatment because it's not allowed.
The things you're speaking of, they seem like from the future. Things that we didn't know can happen today, and you say they can. Why do you think that the world is not acknowledging this and running with it?
Well, first of all, the world is acknowledging, because as I told you, cell therapy that once was considered a myth, now becoming reality. Now the procedure of the year in all the major scientific literature, Nature, Science, conclusions of the American Society of Clinical Oncology. It's a meeting every year where 30,000 hematologists, oncologists from all over the world gather to discuss new things. Practically speaking, they say that the major treatment, the major success in oncology is cell therapy. Full stop.
Is there somewhere in the world where you can perform the kind of things that you want to do? Because currently in Israel you cannot.
You cannot do it, no.
Okay. Is there somewhere in the world where you can?
You cannot do it for treatment, you can do it as an experiment, but that means that some patients will get it, some will not get it. You know, like you do experiment. Yeah. But in the world, you can do it as an experimental treatment, but you cannot provide it as treatment for the patient because as I told you, in order to get an approved procedure, you must do prospective randomized clinical trials. So we are coming back to the same issue.
But you're a renowned doctor. You seem to have a passion for this.
Correct.
Why not go into one of these hospitals and lead one of these trials?
Well, first of all, I did it for more than 30 years when I opened the clinical bone marrow transplantation in Hadassah, and I led that department, which I established, for more than 30 years. And I was doing a lot of experimental medicine approved by the Ministry of Health. I think I was the #1 client of the Ministry of Health. But once I left, my goal was to try to provide treatment for patients in need. Okay, not just as a trial, but as a treatment. For more than 30 years, I proved that cell therapy is effective. Now comes the time when you want to offer it to every patient in need. That's very simple.
And let me ask you, the prices you charge for these kind of treatments are so high. Now, granted, it's private and it's not in the hospital, but still, is it not just a little bit taking advantage of the despair that these patients have? They're dying, they don't have many other chances, and they come to you hoping for opportunity, hoping for a chance to live. Isn't it a little bit too high of a price to pay?
No. First of all, not every immunotherapy is expensive. Some procedures are very inexpensive. Cell therapy was expensive simply because you need to do it in a clean room. Clean room means a team that must be work in a special place, cell processing center where everything is sterile, and that is extremely expensive. It's not the money that doctor takes to his pocket. It's the money that you need in order to use the clean room with all the team, with all the expensive procedures, every done sterilely, with dress up bottom to top in order to make sure that everything is sterile. When I served at the clinic that was in trouble by the Ministry of Health, it cost us more than $230,000 every month without treating any patients, just to keep the system. More than $200,000 every month just to keep the infrastructure. Who will pay for that? Who will pay for that? Insurance will not pay. They say it's experimental. Okay? So a pharmaceutical agency will not pay for that because of reasons we discussed. So who will pay for that? How can I spend more than $200,000 a month in order to treat a patient? Somebody must pay. That's very simple. That is the answer. It's not money that goes to the pocket of the doctor. It must be understood. Also, some of the new drugs that are currently in common practice, by the way, 2 months ago, 2 guys, American and Japanese, got Nobel Prize for discovering the so-called checkpoint inhibitors. Okay, let me tell you, treatment with checkpoint inhibitors cost only the drugs $10,000 every 3 to 4 weeks, and it keeps going on and on and on. So some people say every 2 weeks. Let's say every 3 weeks, you have to spend just $10,000 to purchase the 2 bottles. Okay? Is it expensive? Of course it is expensive. And you know how much the CAR T cell, the newest cell therapy that was developed by my friend, you know how much it costs? One treatment? In some centers, $450,000. In others, $475,000 for one patient, and it does not cure the patient. And therefore, after doing that, they need to do a stem cell transplant that costs between $200,000 to $600,000. So you're talking about nearly $1 million for treatment of one patient, no guarantee for cure. Sometimes the treatment kills the patient. So almost $1 million for one patient, no guarantee for success. Is that better? Or is it better to spend a small fraction of that amount at the stage of minimal disease, avoid months and years of suffering and unbelievable costs and hospitalizations for the patient, trouble for the family, and no cure? Instead, not treat the patient initially with remission that is accomplished in almost every case, and do cell therapy, immunotherapy, to get rid of the last residual disease. That is the simple thing. And unfortunately, it's not yet common practice. It will be. Trust me, it will be.
What can you offer patients today?
I can offer patients today, first of all, to consider treatment upfront as soon as they respond to conventional treatment and reach a stage of minimal residual disease, not to think that they are cured, to consider treatment, because that is the best, if not the only moment to be cured. Because it is very easy, relatively speaking, to kill all tumor cells when you have a small number of residual cells. Then later on, when disease comes back, when you have billions and billions of cells that are resistant and the patient's immune system destroyed by chemotherapy. So consider treatment up front, even if you don't see the cancer, because you cannot see a small number of cancer cells, and every cancer begins with a single cell.
But what kind of treatments are these?
Immunotherapy. When after successful chemotherapy, immunotherapy is the next step. Well, initially, cancer cells are sensitive to chemotherapy, but they lose the sensitivity. Chemotherapy kills the cells that respond. It doesn't kill the cells that do not respond. Furthermore, the cells that do not respond develop mutations, and then subsequent treatment fails. So there's a lot of things that occur that prevent cure later on. In the beginning, when cells are still sensitive, when it is easy to reach minimal disease stage, this is the best, if not the only moment for cure. So patients must understand it. And in order to reach that stage, they should use the best treatment as soon as possible. Precision treatment, smart treatment, and at the stage of minimal disease, consider immunotherapy.
Professor Slavin, thank you very much.
It's okay. I hope many doctors will follow that rationale, or else I don't see future for cure of cancer.